So welcome to everyone to this technical webinar number 10 about green response in WASH and health. I am Ludovic Arnoux, the IFRC WASH coordinator for Asia Pacific Regional Office, and I will facilitate the webinar today. So let's move to the agenda. Next slide, please. So we will start with the traditional COVID-19 regional update that will be presented by Dr. Abhishek, Emergency Health Coordinator. Then we will have a presentation of the Green Response Principle by Richard Casagrande, Senior Officer Recovery and Focal Point for the Green Response from IFRC Geneva. This will be followed by a presentation of the Green Response experience of the Bangladesh Red Crescent Society in Cox's Bazar. This will be done by 3 colleagues from BDRCS, Khairul Bashar, Sector Lead WASH Officer, Ariful Islam, Health and Environment Coordinator, and Latifur Ramad, Field Hospital Manager. Then we will have 10-minute question session. So if you have a question for any presentation, any part of the presentation, you can write it in the chat box or keep it for this session. And we will conclude the webinar with the final remarks from John Fleming, Head of the Health Unit in APRO. Without further delay, I will give the floor to Dr. Abhishek for the COVID-19 update. Over to you, Dr. Abhishek.
Thank you very much, Ludovic, and a very good afternoon to all the colleagues joining this webinar. I'll be taking you through the COVID-19 update, how the virus is evolving in the Asia. At this stage, we have 4 major countries like India, Indonesia, Malaysia, and Thailand, who is really driving the pandemic in this region. All these countries are continuously having more than 20,000 of COVID-19 cases, and the cases seems to be increasing as a passing days, barring India, where we have seen a marked decline in cases over months. We have countries like Bangladesh, Afghanistan, and Myanmar, which continue to report very high positivity rate over 30%, and which clearly indicates the testing capacity in these countries are not adequate to identify the true absolute value of COVID-19. And there are a lot of undiagnosed cases in this country as well. We have Fiji and Malaysia, which is continuously reporting more than 600 cases per million population. And since the beginning of pandemic, Asia Pacific region have recorded more than 46 million cases and more than 714,000 deaths. And in last 2 weeks, we have more than 2.1 million cases and close to 50,000 deaths. It is the Delta variant that is currently fueling the pandemic in this region, and it is highly transmissible. And some of the reports are now indicating like it can be possible of increased hospitalization because of the Delta variant in unvaccinated individuals. Next slide, please. In terms of vaccination, like Asia Pacific have slightly improved in terms of at least the stats concerning the fully vaccinated individuals. We have countries like Singapore, Bhutan, Mongolia, which have clearly more than 60% of their population fully vaccinated with the COVID-19 vaccine. There is a big estimation that there will be another East 10 countries that will be added to the list of fully vaccinated individual crossing the 50% mark by the end of September. However, we have several countries in Asia, primarily where we have seen a very small percentage rise in vaccination. Like these countries are primarily between 2 to 10% of the people fully vaccinated with COVID-19, and lack of supply of the vaccine as well as the vaccine hesitancy are the major barriers in this country to really scale up vaccination. Next slide, please. Asia Pacific Regional Office have also come up with a country profile analysis where we are analyzing the 6 different indicators to understand like which country are at higher risk and which are at medium risk and which country are at lower risk of COVID-19 surge, as well as if the COVID-19 infection rapidly increases, the health system are weak enough and cannot cope with the situation. So at this point of time, we have 9 countries in this region which are categorized as high-risk countries, and these are Afghanistan, Fiji, Indonesia, Nepal, Myanmar, Bangladesh, Philippines, India, and Malaysia, which are primarily regarded as high risk of increased cases of COVID-19, as well as the health system getting overwhelmed with COVID-19. And we will see as the time passes, like if we can have longer or the bigger portion of the green, where we indicate the pandemic is more or less in control in several countries. So next slide, please. Yeah, so these are some of the resources which are available, where you can go to the IFRC resources and we can access the health help desk, where you can have several information regarding the IEC material, guidelines and tools that will help you to implement the COVID-19 response, as well as we have the Asia Pacific portal, which have several dashboards, including the vaccination, the country profile analysis, etc., which will be updated every week so that you have the real-time data around the emerging risk of COVID-19 in your region or in your country. So that's a brief update about the COVID-19 situation in this region. Back to you, Ludovic.
Thank you very much, Dr. Abhishek, for this update. So as mentioned earlier, if you have any question related to this part, you can write the question on the chat box, or you can keep it for the question and answer session. Now let's go to talk about the topic. So you may have heard about the expression of greening the head. You want to have a better understanding of what is the green response. How can you contribute to green response? So I will give now the floor to Richard that will answer to these different elements now. Over to you, Richard, and I will let you know when you have 5 minutes remaining.
Great, thank you. Thanks, Ludovic, and thanks for the opportunity to present here briefly and introduce to you green response. I'm going to take control of the PowerPoint, if that's okay. Right. Okay. So I'm going to talk to you the next 15 or 20 minutes about green response as a global initiative for IFRC, and not just the Secretariat, but the IFRC network. So I'll be talking in quite general sense about environmental sustainability as a cross-cutting theme. I won't only be talking about how this is relevant to WASH and health, but I know that we'll be hearing some good practical examples from our friends in Bangladesh of practical implications for health and WASH. But first of all, what is green response? What do we mean by this? Now, hang on, this is not showing my animation. No. Sorry, I can't seem to get to... I'll stop that and try again. Could we put them up again? Or Ludovic, shall I just share it from my deck? Is that also okay?
Yeah, it's working if you want to do that as well. Yeah.
Okay, let me try that. Sorry for the delay. We've been doing this so much for a year and a half and we still can't seem to get it right. Here we go. Let me see if I can open this. Okay, let's try again. What do we mean by green response? Well, we do have a definition, actually, and it comes from our own Secretariat, IFRC Secretariat Environmental Policy, saving lives and reducing suffering without risking damage to the environment or the livelihoods, assets, health and survival of affected people. So what we're really talking about here is environmentally sustainable humanitarian response. Or if we use another term that the United Nations prefers to use, the environment in humanitarian action. But you can see from that definition that we're still talking about doing what we do as humanitarian responders, but trying to make sure that we do it in an environmentally sustainable way, that we don't harm the environment. I want to talk briefly about why this is a priority for us within the Red Cross. And we've been making promises and commitments for many years Some of them you can see on the screen there. I won't go through them in detail, but Sendai framework and the Sphere standards, our own code of conduct and principles and rules, our new disaster risk management policy. They all talk about making sure we protect the environment when we respond as humanitarian actors. But I want to single out these four quite new and recent commitments. First of all, we do have a new environmental policy as the IFRC Secretariat from 2019, and this really commits us to the concept of green response. As you're all aware, we're all working under a new strategy now, Strategy 2030, for all national societies and us, the Secretariat. And Strategy 2030 has very clearly as strategic priority one, addressing the climate and environmental crises. So it's really in our strategy now, and that's why, as the Secretariat, we're now really taking this theme seriously, and why I'm sitting here today talking to you about green response. We also have some movement commitments to address the climate crisis, which came out of the statutory meetings at the end of 2019 that ICRC, IFRC and national societies have signed up to. And finally, and possibly most importantly, this year we now have the new Climate and Environment Charter for Humanitarian Organisations. And if you haven't heard of this is something that ICRC and IFRC have developed this year and endorsed and opened up for other humanitarian organisations to endorse. And I'm going to show you that briefly here. So far to date, almost 100 humanitarian organisations have adopted the Charter. And there are 7 commitments in the Charter. I won't go through them now, but I just want you to be aware that the second commitment is really referring to the heart of green response. I have to squint to be able to see the small print there, but commitment 2 in the new Charter says maximise the environmental sustainability of our work and rapidly reduce our greenhouse gas emissions. Okay, so the main point to take away here is that we've made some pretty serious commitments to this, both the Secretariat and the wider IFRC network, and we're starting to move on this now. Okay, you'll be thinking that's a lot of big words. What does that really mean in practical terms? So really, green response is made up of 2 components. First of all, we want to make sure that our programs and operations are not contributing to further climate change or minimizing our contribution to further climate change. And that means reducing the carbon footprint of our humanitarian work where it's possible, okay? Reducing carbon emissions or greenhouse gas emissions. And what that is in technical language is it means climate change mitigation through our operations and programs. But green response is not only about climate change and mitigating climate change, it's also about making sure we don't cause damage to the environment in other ways. Pollution, deforestation, other forms of environmental degradation. We have lots of WASH people on the line. You'll understand very well. Polluting water sources, for example, or depleting water sources. Managing natural resources responsibly. So green response has these 2 elements to it. Now, there's often a bit of confusion about climate change mitigation, climate action, green response. So I want to just explain with one slide a little bit further what's the difference between these. We read about these terms every day in the media, but it's not always clear to everybody. So when we talk about climate change mitigation, we're talking about preventing the climate change crisis from getting worse, okay? Reducing the changes to the climate. So what that really means in a practical sense is reducing carbon emissions or our carbon footprint or greenhouse gas emissions, which all means the same thing. And that plays out for us as organizations in 2 ways. One is at the organizational level, where we're talking about how we run our offices and our supply chain, our policies for travel, when do we fly, when do we drive, when do we take the train, our fleet, what sort of vehicles we have. But more importantly for what we're talking about today, at the programmatic level, it's much more about things like, are we purchasing locally produced materials in local markets? Are we promoting the use of clean energy instead of diesel generators in our programming? Are we purchasing sustainable materials or more sustainable options? So that's the climate change mitigation side of things, the reducing carbon emissions. But also we have these other environmental issues, like trying to reduce pollution, environmental degradation, addressing issues like biodiversity and species loss, or making sure that our programs and operations don't contribute to that. And at the practical level, this means things like better waste management, reducing plastics and packaging, protecting natural resources, making sure we treat fecal sludge in a safe and environmentally sustainable way, these sorts of things. Now, when people talk about being green, greening, or greening humanitarian response, it really means these two elements, okay? Reducing our carbon footprint and making sure we don't harm the environment in other ways. And what we are really focusing on with green response is these two parts at the programmatic level. So when we have an operation, a humanitarian response, when we have programming, the decisions we make, the changes we can make to the health, the wash, the shelter interventions to achieve this. So that's really what we mean by green response. Now, we do have a green response working group. And what I haven't said at this point is we do owe a great debt within the membership to Swedish Red Cross for having kick-started this work some years back in 2014, together with Canadian Red Cross and Australian Red Cross, and really starting to advocate for this idea of environmental sustainability. So we have had a green response working group across our network for some years. As of this year, the IFRC Secretariat is now leading the working group. And we have some 20-plus national societies in the group, also ICRC, and representation from different parts of the IFRC Secretariat. And the membership is starting to grow. But essentially, the Green Response Working Group is a network to promote everything that we're talking about today. What is green response, and what are some of the best practices that we can start to think about? So I will repeat this again at the end, but we do encourage national societies to join in. It's an informal network. We're trying to share best practices and connect you to useful tools and resources from outside the Red Cross. And also what will be coming in future months is some materials and tools that you can use within your own organizations to help promote what green response is and how we can have more environmentally sustainable humanitarian operations. Okay, that's climate change adaptation. I didn't want to go into it too much, but I just saw that question pop up. Climate change adaptation it's closely related. We might say climate change adaptation is the brother or sister of climate change mitigation. But climate change adaptation is actually a type of programming which is helping communities to adapt to the effects of climate change which are already here. So it's actually more closely linked to disaster risk reduction as a type of programming. Whereas when we talk about climate change mitigation and green response, we're talking about changing the way we do our core sectoral activities, the health, the wash, the shelter, the livelihoods, the logistics. We're not talking about a new type of programming. We're talking about improving the way we do our normal work. Whereas climate change adaptation, we can consider to be well, it's not really new anymore, but a type of programming that's working with communities to help them adapt to climate change that's already there. Okay, so there is a difference between the two. Let me move on here. So you'll be thinking, okay, so what are some of the practical examples here? What are some of the things we can do? And I won't go through all of these in detail, and these are not necessarily what we are saying we need to try and do in every humanitarian operation and all of your humanitarian responses. But these are, if you look at materials coming out from the United Nations and some of the environmental networks that are out there, coordination networks, also what some of our major donors are starting to say, particularly ECHO from the European Union, these are usually the typical examples that are given. So I want to run through a few of them, and maybe I could try and highlight how some of them are relevant to health and WASH. So the first one is about household energy, particularly in displacement contexts, and we'll hear about this from our Bangladesh friends, I'm sure. So if we are providing food assistance or cash assistance, which people will be using to buy food, how will people cook the food? What is the fuel source that they will use, and what are they cooking it on? Because we don't want to be in a situation where people have to resort to cutting down trees in order to cook their food. And we've seen this in many refugee contexts. So in some responses, we really need to think about this question of household energy, and it might be essential to actually provide cooking fuel to households to make sure that we don't see deforestation happening. The next one is clean energy, and in particular, the use of solar is a good example, and WASH has the classic example, using solar power for water pumps, solar water pumps instead of diesel generators. And we have some examples of this, but it's not really systematic yet. Also, in shelter programming, can we promote or should solar lamps and perhaps solar panels for household energy be part of the shelter designs that we promote as part of reconstruction and recovery programs? The next one is better waste management. And this refers to any waste that's generated by our program activities. So it could mean we need to think more about what happens to the items, relief items, hygiene kits, shelter kits, whatever it is. What happens to the items that we purchase and provide to communities at the end of their useful life? Does it just wind up causing pollution? So we need to have a think about this, either waste management and disposal, or perhaps rethinking the types of materials and items that we're purchasing. But it can also mean waste management from programs like sanitation and how we treat fecal sludge. Also, promoting the use of sustainable construction materials. This is, again, quite relevant for WASH and shelter projects. What sort of construction materials are we using? Making sure they're sustainable, perhaps in shelter projects, promoting the reuse of rubble and debris after natural disasters. Avoiding deforestation is often singled out because deforestation can be caused as an unintended consequence of shelter projects, food assistance, cash assistance, livelihood projects. We've had many examples of these over the years. So it's just very important to make sure that we're not providing, our projects and programs are not providing incentives for community members or displaced people or refugees to go and cut down trees because they have no other coping mechanisms. Also, minimizing plastic use and especially trying to eliminate single-use plastics, especially relevant for thinking about, NFI kits, hygiene kits, and these sorts of things. What plastics are in there? How are they packaged? And finally, the last one, promoting, although these are not black and white, but promoting cash and voucher assistance and local procurement. But cash and voucher assistance is not always more environmentally sustainable. It means that we don't have to purchase items and transport them, but people still have to go to the market and purchase what's available on the market, and that may or may not be green or environmentally sustainable. And similarly for local procurement, if we're talking about procuring locally products that are produced locally, then that may well be more environmentally sustainable than international procurement, which is being shipped. and coming a long distance. But we can't take that for granted, and it's important to look at the local supply chains and try and understand if locally produced materials for hygiene kits, for example, are actually coming from reputable suppliers and with good environmental standards. Okay. So
you have 5 minutes left, Richard.
Great, thanks, Ludovic. So that's given you some of the practical examples of what we mean by green response. I just want to briefly mention that from our perspective, sitting in Geneva, and our regional colleagues in the Federation and country offices, we'll also be looking at how do we operationalize this, meaning how do we embed this in our system of humanitarian response? How do we see this happening? And we have to look at surge trainings, surge role profiles, and who's responsible for what, and in an operational context, our operational management and leadership, what are their responsibilities to make sure that we're being more environmentally sustainable? We have to look at the assessment process, the needs assessment process, and make sure that we're considering environmental risks as well, and not just understanding the environmental impact of a disaster or crisis, but also analyzing a bit the potential environmental impact of our own response and recovery interventions. Okay, so we're not proposing that we need to have big standalone environmental impact assessments. This is not feasible, but we need to see how we can better integrate consideration of the environment into the assessment process. Similarly, for National Society Preparedness, most of you will be aware of the PER, Preparedness for Effective Response approach to preparedness. We need to see how we can reflect environmental considerations better in there. And in our own operations management process, and I'm referring to our planning process, tools like the emergency appeal, the EPOA, the DREF, these are being revised at the moment, and you will see the theme of environmental sustainability or green response included in those new tools and templates explicitly. And we'll also be developing some materials to share with you all, hopefully simple and practical, about some of these green response best practices. Very briefly, I just want you to know that there is something called the Sustainable Supply Chain Alliance happening. It's an ICRC and IFRC joint initiative. It's happening at the global level, and it's all about greening logistics and greening the supply chain. And I don't want to go into any more details. If you're a logistics person, I do suggest that you try and follow along with this. There's a lot of projects around greener procurement, looking at the specifications of relief items to make them more environmentally friendly, actually research projects to develop a new tarpaulin and a new polypropylene bag, which food normally comes in, food aid, to see if they can be made more environmentally friendly. It's looking at fleet and vehicles, and it's also looking at a project to develop a tool that all of our organizations can use to measure our own carbon footprint as organizations. Right. And, response, I've talked mostly about it from the perspective of doing no harm, so making sure that we don't harm the environment through our humanitarian response. But I think, as you're all aware, the climate and environment crises are growing worse by the day. So we also need to think a little bit outside the box of how can we promote positive environmental outcomes. So we could be also thinking about new types of activities in our programming, in our operations, like how we can promote the circular economy and reuse or upcycling, so waste management, which can actually provide livelihoods opportunities, or how we could be using green products that actually have carbon accreditation. And I have a couple of examples here just to run through before we close, just so you know some of the things happening amongst national societies. In Kenya Red Cross, in the big refugee camp Dadaab in Kenya, they have a plastic recycling initiative where the camp and community members collect plastic waste and they shred it, and it's sold to generate an income. We've seen Rwanda Red Cross distributing to communities something called the Wonder Bag, which is a bit like a fuel-efficient stove. It's much cleaner cooking, less respiratory diseases, less smoke, and less use of wood or fuel. But this product comes with full carbon credit accreditation. So there's actually an income stream that comes back to the National Society branches every year for each Wonder Bag that they supply to a community. Bangladesh Red Crescent we're going to hear about, so I won't talk about fecal sludge. We have Lebanese Red Cross that has piloted the NEAT Plus assessment tool for their WASH programs in long-term displacement camps. So they've actually tried using this environmental assessment tool. And Costa Rica Red Cross, they've had a green fleet project for the last few years. And they have, through that, managed to really reduce their carbon emissions and their fuel use and therefore their costs across all of their ambulances and vehicles. And I know there are more examples out there, and I'd really like to be hearing from any of you if you do have those examples to share with us, since we're really just starting this year on this topic within the Secretariat. Last slide. I hope I'm on time here, Ludovic. How can you contribute to this? First of all, please join our network, the Green Response Working Group, and follow along. It's only a meeting every quarter, but we're trying to share useful materials all the time. Share with us, and feel free to share through Ludovic by all means, any examples you have from your own national societies of green or environmental initiatives. We'll be sharing with you some useful tools and information products soon, and you'll also perhaps be able to help us review these new tools and make sure that they are useful. Thank you. I think there's a bit of time for questions later, and I better stop there. But thanks again, Ludovic, for the opportunity to talk about Green Response.
Thank you, Richard, for this comprehensive presentation. So as mentioned before, if you have questions for Richard, you can either write it on the chat box or you can keep it for the question and answer session. So let's share now some concrete example experiences in WASH and health in Bangladesh by the Bangladesh Red Crescent Society. Kerul, the floor is yours.
Thank you. Everyone can hear me, right?
Yes, we can hear you.
Okay. Thank you, Ludovic, for giving us the chance. So, I'm Kerul working in ERCS and the WASH sector. Okay. So, here we're going to say about the green response in innovation we already did the last couple of years, or let's say 3 years in this university. In camps and coastal areas. So getting into in this slide, you will see that some of our partners are working with us. So it's a very brief about the camps. Like it's almost 1.3 million MTMN, both dispersed from Myanmar, right? And our government of Bangladesh allocated 5,800 acres of land for these camps, and it's by the guidance of government, we make 34 camps. And more than 115 local NGOs and international organizations are working with this influence. Next slide. For a cleaner camp and environment, so you can see here this the transformation of own operations to carbon neutral and extending in carbon dioxide free power generation of waste and waste management. So you see, like, so one of the action should be like the phase out and existing oil and fuel, because you know that for that there is a very some negative impact, like the pollution impact in the climate change. Also, if we use the fuels, so there that is a one action point, like to phase out from the exit of the using the oil or fuel, transform fuel generation towards the solar. So using solar more, like the natural resources we have. Provide services with significant, flexible, and reliable carbon dioxide free power generations, solid waste management services to keep the environment clean and safe, fecal sludge management, because you know that if we do the fecal sludge management properly, so that also sells the environment. Next slide, please. Okay. So here you see a pictures like how we do our like water network in Cox's Bazar camps area basically. So in camps area basically now we are distributing water. We call it like chlorinated water by using the solar panels. So we use the green energy here. So when we are using the solar, we are using the green energy of sunlight because it will be forever. It will not waste. So we use the solar panel by using a submersible pump. We pump out the water and we store it in the water tanks, and then after the treatment with fluid distributed through harvester. So here in one picture you can see like almost a whole process here. So how we use the solar panels and how we convert this energy to distribute the water and dispense people here. Next. Okay, here is some pictures. Actually, the existing network we have in camps. So here is the pictures like how we solar panels. So according guidance of a technical person, we always design the solars, and because due to scarcity of land or space, you can say we use like the roof of some of the shelters here to the solar panels for the solar panels. So you see, it's also helpful for the people because it also keep them keep them out of the sun also. Next one. Okay. So it's just a brief about like why we say like the solar as a green energy, because the solar energy is regarding as green because it's a natural resource that cannot run out, because and almost we know that there is no negative impact on the environment if we use the solar. The traditional energy source like fuel, oil, if we use these things, it also could be like run out after sometimes, and it's have massive impact for the environment also because of the natural calamities, natural changes, also like pollutions happen. So that's why we wanted to like reduce the use of the other energy like oil or fuel. So we wanted to improve like solar panels using more, so we can save the environment as well as we already doing this. So that's one of the inventions. So that's why we are saying the solar as an green energy. Okay, so here is a very interesting one. So you can see, you can compare like why this value for money. That's also a thing when we are designing a program, a project. So we also have to think about value for money as well as we have to think about the environment. So here you can see like the total amount of cumulative total of for solar is like 68,629, and if you see the total of the using the diesel used generator system. So how is the difference? It's like more than 40 million. So if you see like what's the difference, like if we discuss about the initial cost, like in solar power system, initial cost is a little bit higher, almost a double from the initial cost of using a generator. The maintenance cost is like almost 1/3 of the generator maintenance cost. So here you see like the difference. The servicing cost is almost uh, uh, different with the generator and the solar. So in generator the servicing cost is too much. The major overhead helmeting cost is like almost similar, half. You will say there is no actually major overwhelming cost in solar. For the spare parts, the solar have the almost the double of the cost of generator. But if you see the fuel, where is the different actually? Because in solar we don't need to use any other energy. We can use the sunlight, and it's like free. It's from the environment, and it will not be finishing it for sometimes. It will be for forever. But if you see in generators, you have to use the fuel, and its cost is like if you can like just compare with the solar system, or then it's huge. So you can say also in value for money also it's a huge impact with the project. Like if you can use the solar as well as it's environment friendly, it will also save our environment. It will save our next generation as well as the money. So I think this slide will help you more think about like how we can move to the solar powers, because in every country the solar the sunlight is available, so we can go for the solar certificate easily. Next one, please. There is another one. So in this, we discussed about the vehicle source management treatment plan. Pegasus treatment plan in FSTP. Here is the pictures of aerobic, the existing one we have in camps. So it's solar power. Because if you see in the second image, like there is a hydro tool and alloy in this picture. So we used to run these two machines for the whole days and night. So for this, actually in camps area, we don't have any electricity. So we used to now use the solar power in last year, from the beginning of the influx, like in 2018, we started to run this system, and we run this system with the generator, and it was like highly operational, very much high. So now we do a replica in other camps, and now we are using the solar power system. So it also saved lots of money, and it also become too much environmental friendly. For this system also, we use the solar power because we have to run this hydro and all that. So we use this solar power to run this two machine. It also saves our money as well as the environment is saved. And you can see in the top row in right the pictures, the before treatment and after treatment. So what's the difference of how we are using this treatment plan? So that's also using by solar. So here you see the difference and how we are saving actually serving for the community in here in Crescent actually. Next slide, please. Okay. Before we going this slide, it will be presented by one of our another colleague, Mr. Arif. So before we go this one, I wanted to add a very brief one for all of you because we already start a new project here in Crescent with the support of Swedish Red Cross, and we call it Green Response actually. So that's also similar with the topics names we have today, the Indian name. So we call it the Green Response. We already did the assessment and analysis our data. So we find some of our action, and we keep some actions like that. We will go for deep plantation almost in coming days, and as well as we will upgrade our system because still in our solar power system we have to use the generator when the sun is not coming out, like in rainy days. So we also wanted to try the upgradation of our solar system, so we can use the batteries there to be used the generator in coming days. So that's also another action point. We will do the solar waste management properly on the other side. In BDS is working here where we still not started yet. So that's sort of action point already take for the green response. Okay, now the floor is yours, Mr. Thank you.
Thank you, Khairul Bhai. Thank you, Ludovic, for giving me a scope to say something regarding particularly focusing on the green response. So as there has a lot of discussion, I think I need to make it slow. As you already know that waste management is the different concept is still already in the worldwide globally, but I am focusing actually here in on the concept on particularly the zero waste that is considering the reduce, reuse, and also the recycling. So this is a concept, that concept is globally used, and also all sorts of waste management is considering in through this particular concept. So next slide, please. So the based on those concepts, I'm actually sharing some sorts of activities that we already have ongoing and also did. So here you see that's actually some sorts of picture. That picture actually gives the information like the equipping and establishing of MRF. MRF means we are sorting out, it's the material recovery facilities. That facilities is actually is a center, that center used for waste management purpose. Here we have actually provided all sorts of logistic, particularly the waste collectors, waste segregator, and the supervisors and other people who are involved in this waste management. They receive personal protection equipment. They receive all other logistic which is related to the waste management. I think the picture can give you the more information. You also have seen that some sorts of distribution of waste bin that we have provided to the household, shops, schools, and other facilities in the camps and also in the host communities, because it is the most essential element of any waste management, particularly the bin. There are the two types of bin. One bin is the for particularly distribution to the household, and another for using in the facilities. As we are saying, it's the community bin. So please, next slide. So here you have also seen that in the household how the waste collection is going. Here you have also seen the bin, that the two color of bin, and that is the primary source segregation is there. Particularly in the house and also in the community places, there are two types of bin in there, and the two types of waste, organic and inorganic, that is differentiated in the source, in the primary source, and it is segregated also there. So that is the basic thing, that in the household or in the community places, particularly shops and other facilities, the two sorts of bins, and they are actually managed it through two types of waste. We are dividing into organic and inorganic, and after that our waste collector are going there and collect the waste from the two sorts of waste, inorganic and organic, to the van, that we are the transportation to, and then it come to our the transportation center. So when the waste is coming to the MRF center or the material recovery facility center, again the waste is segregated, and here again we have actually two sorts of things are particularly divided. One is organic, another in inorganic, but the different value, like in organic part, we actually got many sorts of inorganic materials, suppose the plastic bin, metal and other things, and in other hand we have also received some sorts of organic materials. That materials is particularly focusing on the vegetables, some sorts of wood and other. So these two sorts of segregation is there, and it is also the measurement is there, the how much actually oil for the organic and also the other sorts of inorganic materials. So oil measurement is also in the MRF center is done. So next slide please. So this is the key thing. We all know that the waste, how the waste can be used further. That is the key thing. You see here is a waste to organic compost, how it can be used. So in practical, there are two types of decomposed here. One is the one we are saying that the fast decomposing, that particularly the vegetable or some other materials which is the green, and that will be actually going through a process. And another thing is the soft decomposing, that some sorts of wood and bamboo, that is the another matter. So these two sorts of organic materials turned into the organic compost. It takes 28 days to more than some of the cases the 3 months, but the thing is that though after that the compost will be used in the different purpose. And what we are doing, particularly we have a good agreement with the HEX. They have actually engaged this compost fertilizer for the livelihood programming. And if you have seen the other thing like the inorganic segregation, we have actually received a lot of materials like the metallic things, some other things like the plastic, that things is again for the reuse. We can actually supply it to the scrap dealer. So that is the waste to organic compost, and also the inorganic thing is going to the other people who are the scrap dealer. They buy it and they actually sell it for to the again recycling purpose. And that's again next slide please.
You have 2 minutes, Arif.
Yeah, thank you. So here is what actually we did. One is the coordination with the different partners. Here is the many partner involves BRAC, UNDP, practical action, and also we have some sorts of training based on the waste management and giving them the awareness on the infection prevention control protocol, and other thing the behavior sense communication, particularly the leaflet distribution and hand biting, so people can aware on the solid waste management, although the hygiene practices and others. Please next please. So it is the picture that what was seen before 2000, that means in 2018 there are some sorts of problem in our community, but after intervention mean now current time through our system and through our practices we have seen some sorts of environmental and the free hazards community. So next please. So two things I want to share with you that what we actually have seen that the vector-borne disease or some sorts of water-borne diseases and some other diseases which is in practically coming from unhygienic condition and also the some environmental hazard, that is reduced by the sorts of work. And even we have some data, that data is suggested that the acute watery diarrhea, acute respiratory infection, that is also reduced, and also the malnutrition is reduced. So the data we have already, so if you need we can share with you also. So the other thing is that here the COVID-19, so this transmission can be also prevented by these sorts of solid waste management. Next please. So I think this here I have shared with some key things that solid waste management, and so and also integrated with some other health component, because health and environment is one with another in correlated. We have observed that when the cleaning environment is done, then the morbidity and also some sorts of disease, suppose the vector-borne disease and the water-borne disease, that is also the control. So thank you. I think if you have any more questions in the next, we can share with you in this regard. Thank you.
Over to you, Latifur.
Thank you very much. This is beautiful. Again, and thanks to you for giving this opportunity for this presentation. And basically, just I share some things the part from the BDS hospital, field hospital. Due to new influx of poverty displaced from Myanmar nation since August 2017, BDS with asset of IFRC and PNS ensured the fast responders since 2017. Basically, we followed the. Do you hear?
Yes, we can hear you. Yeah, please go ahead.
Yes, basically, we are following the Bangladesh government waste management policy as well as WHO policy, and for this particular, we are used color bin, and that is 5 color bin, collection of waste. Then we segregated the waste and dumping, and then we inserted with crusher. Next. Thank you. Already I told you just we have used 5 color bin. One is black, that is we use for general waste, and that is for leaf-over mills, administrative rubbish, papers, sweeping, and then for we use yellow bin, which is content of clinical lab waste without sub-objective. And like this is like materials used in lab patient care, and then we use for red, that is the dangerous, and red color. This is clinical waste with sharp objective. That is needles, for example, scrap blades, knives, broken glass, etc. And then the green bucket or bin, this is recycle waste. This is saline kits, like that. And finally we use the blue bin, that is liquid dust, vomiting blood, etc. Next slide, please. And we have already we have existing medical waste management system at field hospital, that is waste type, like sharp needles broken, isolation, medical or contaminated waste, liquid waste, that is blood vomiting, already mentioned, and process with encapsulation and burial, incineration, and for yellow bin for product, and then disinfected and burial. And transportation, that is from those items, star boxes, tape clothes, and transported in thick black bin bags. Yellow bins bags in closed truck, transported in thick black bin bags, that is polythene actually, black bin. And finally, note when sharp box full buried, go into soil and steel. And then yellow beans emptied daily. This is our policy. We emptied every day by through our cleaner, and I will have respective party for this purpose. And was buried with solid after is dumped, and then been emptied daily and washed. Washed, buried with solid after is done. Next, please. The picture we have shown, three pictures. One is the safety box, hazard safety box, that is a sharp instrument, we fill the substance in this box, and we transport this trolley. We have the big premises which collected, maintaining the infection prevention policy, and we use this trolley for collection the all type of things. And then this is our incinerator. It is the incinerator is the backside of our hospital, and this is we inserted it for the more than 700 centigrade temperature. This is the international policy, WS and Bangladesh government policy. And next, please. And this is the graph actually. We want to show how we can manage our medical waste management. Just briefly, already discussed detail. With calculation from communal bins, then we transport it for medical waste management. Then we followed the liquid waste, general waste, biograde waste, clinical waste with the sharp wastes. That we then go for this infected, and we dumping it. You have another dumping pit where we dumped all the installation things, and then we inserted site for burn, that is ash pit. We have ash pit, and we follow the sharp wash process. We disinfect it, then move to the bin and seal and dumping. Next, please. So thank you very much from our part.
Thank you very much, Latif. So we are reaching the end of the webinar, so meaning that we will not have time for questions, but I think it was important to give more time for the presentation. So I think today it was very good to hear about the green response and the experience we had in Wash and Health in Bangladesh. For sure, we will do follow-up webinar in coming months about green response. So for the final word, I will hand over to John. You have 30 seconds, John. Over to you.
Thanks very much, Ludovic. I'll do it in 30 seconds. Thank you all so much. I see a lot of hands clapping here, which is a real tribute to the presenters and indeed the topic. So as is customary in these closing remarks, this is number 10 this year. We had 33 last year, so 43 of these technical webinars, and they continue to be very well supported. We had over 60 people today, and this one in particular, colleagues from many areas of our work. I see logistics and disasters, climate and crisis, of course, health and WASH. I see some colleagues from volunteering and the urban centre, and some other colleagues, of course, from different units, and more particularly and equally as importantly, I should say, colleagues from many national societies in the region. I mean, thanks really to the Bangladesh Red Crescent Society. I had no idea such incredible work was being done there in regards to this aspect of work, and I see somebody else has just thanked you as well, Bangladesh Red Crescent Society, and specifically Khairul, Ariful and also Latifer. Thank you so much for your presentation. They were really, really interesting. Great that you showed photographs, because this really put everything in context. Thank you, Richard. We worked together over 10 years ago in Haiti, and it's very nice to see you again. And thank you so much for putting everything in perspective at the beginning of this session. I think it's really, really interesting. You really provided the foundation on which the Bangladesh Red Crescent Society presentation was built. Of course, as usual, thanks so much to the support of the team here in Kuala Lumpur, particularly, of course, in this case, all of the background work that was done by our colleagues, including, of course, Ludovic. Thank you, Ludovic, for organizing this. Of course, Abhishek, for your customary, very clear and precise update on the pandemic and as it is affecting that, and the positives as well, of course, in regards to a gradual uptick in regards to the vaccination rates in many countries, still a long way to go, and of course to Jesse as well. So everybody, thanks for your participation today. We know everybody's really busy, 70 people today. It's an indication of the importance of this topic, and as Ludovic has mentioned, we've just really touched the surface, I believe, today. There's so much more to learn and share on this topic, and I'm sure with our colleagues from DCC and other units, we will develop more sessions around this topic. Thank you all so very much for your time. Thank you again to the presenters, and I wish you all, in the case of our colleagues in Europe, a very good day, and for our colleagues here in the Asia Pacific, a good afternoon, good evening, and we'll see you again in 2 weeks for the next session, the next technical webinar. Thank you all very much indeed.